Hello and welcome back. The Scaling Without Breaking podcast is so honored this week to have a new guest, and let me introduce him by saying that he spent 15 years as a neuroscientist, including a decade leading research at one of Europe's top psychiatry hospitals in a city where I also live, but I didn't go to the psychiatry hospital. He's published in Nature Communications, discovered that our brains are more plastic than we thought, and became obsessed with one question: why can't psychiatry be as objective as the rest of medicine? So he left academia to build the answer. His technology uses a 30-second smartphone selfie to measure your emotional state through changes in your facial blood vessels. No wearables, no special equipment. And here's the controversial part. His clinical trials show that these objective biomarkers predict your mental health better than what you tell your doctor. Better than what you tell yourself. Half the psychiatry field thinks he's wrong. He thinks they're stuck in the 19th century. With that, everybody, meet my guest, Dr. Bechara Saab, CEO and Chief Scientist of Mobio Interactive. Welcome to Scaling Without Breaking, Besh.
Thanks a lot, Roland. Great intro.
Oh, absolutely. It's a new field for us. We have not touched much on psych tech, or however the term is these days, but I'm honored to have you here. So, Besh, you've said you can measure how someone feels better than they can say it for themselves. That's a bold claim. Walk me through what that actually means.
Well, if you take it at face value, it means that the way that we are able to assess biomarkers from the face provide information that is then interpreted by a neural network form of AI in order to create a measure of how you feel. And if we look at that compared to what people say, we find that it's superior. And it's superior, to get into a little more specifics, it's superior in a couple different ways. One is it doesn't fall for these biases that we tend to fall for. Most demonstrated one to date is the expectation bias. When somebody starts therapy, for example, they kind of expect the therapy to work more or less right away. At least on average, people do. But in truth, therapy actually can be quite stressful at the beginning as you're getting the hang of it and understanding if you're doing it right, etc. The computer picks up on that, right? The selfie scan plus the neural network identifies the fact that people actually have increased stress as a result of therapy early on. And then it takes 5 to 10 sessions before you start to see an acute decrease. So that's one way that it's clearly better. It's not falling for these tricks that our mind plays on us, these many biases. The other way that it's better is if you use the self-reported data for how good a given psychotherapy session is, or if alternatively you use what the selfie and the neural network provide in terms of how good something is, and then you take those data sets and you use that to train and predict what will be best for an individual patient. The predictions that you get using the objective data are more accurate than the predictions that you get using the subjective self-reported data. And in fact, if you combine all the data together, you still end up with a worse result than if you just exclusively focus on the objective data. So
a lot of this is sounding very good from a scientific point of view, but can you help us get a bit more of a concrete image? Like, what does it look like? What kind of biomarkers are we talking about? And in the treatment plan, for example, what kind of different options might come up with the help of the app?
Great, yeah. So important to introduce the app. So we have a patient-facing mobile platform. It's a multi-prescription digital therapeutic platform that has these embedded tools, both to see how people self-assess themselves, as well as this computer vision technology that allows us to objectively understand how people feel. And right now, you get these recommendations after you've completed enough sessions that have the appropriate data. You start to get recommendations on particular psychotherapy sessions. And on our platform, it's a mixed bag. So we have mindfulness, we have other forms of meditation. We're introducing self-hypnosis soon. We have sound and music therapy, a lot of psychoeducation, and then some CBT-like practices as well. And so which specific psychotherapeutic session you get on our platform, the recommendation for what you should do next really comes from the objective data that we've used to measure what previously has been efficacious for you. And it's our aim to ensure that our measures are outside of somebody's control, so that somebody can't fake how they feel by giving us a smile, like, but they're not actually happy. We wouldn't want to pick that up as being happy. Interestingly enough, when you fake a smile, the microexpressions around your eyes are actually different compared to when you have a genuine smile. We're essentially providing exercise for the brain.
Mm-hmm.
Right? That's what our therapy is. Particularly exercise for the prefrontal cortex and how the prefrontal cortex communicates with other areas of the brain. That is good for everybody, regardless of where you are, right? It doesn't matter. You don't have to be sick to benefit from the type of therapy that we're providing, just as you don't have to be sick to benefit from exercise, in terms of improving your heart health and your skeletal strength and your muscle mass, et cetera. So the use cases for us are profound, right? Unlimited, one could say even.
But it sounds like there's a lot of scientific and experiential learnings going into that app. And so the way you talk about it, it also sounds like the recommended paths are not always going through a licensed psychotherapist, right? It can be some form of self-help as well, some form of meditative practice or CBT, as you mentioned.
Yeah, actually, that's an important thing to discuss. We built the platform to be used in a healthcare context, so with the support of a provider. However, there are many people that use it completely independently, and many tens of thousands of people, and it's fine in that use case. And we see the demand there, and so the next iteration of our platform will be even more easy to use initially, and that's something that we're excited to launch in May.
Okay, and so how do you envision the business model behind this app? Will you primarily get your compensation from the clinics that you work with or the providers, or is this ultimately a multi-sided business model? How do you look at that?
We're B2B. The way that we commercialize depends on the healthcare economy structure within a given market. So in places like the United States and India, where it's either through CPT code / reimbursement or out of pocket, India in case it's majority out of pocket, then we work through the providers, and they actually are selling the software to the patients, and we'll be able to capture through different mechanisms a portion of the revenue that they generate. So it's revenue generating for both the provider and for us. In markets where the health system is public, single payer, government is just paying for the bill for everything anyway, there it's much more simple. We go in and we provide a license to the healthcare institution, and then it can use it for various different things. We have different prices for different use cases, but in all, across the board within a given use case, there's an unlimited number of patients that they can bring in.
So what's been your strategy in which markets to target? Obviously, you're a global citizen. The map behind you tells this, but are you going all around the world, or are you targeting very specific markets where you think there's a better entry point?
We're targeting Singapore, Canada, and the United States as our primary markets. Last year, using funding that came from the Johnson & Johnson Foundation to train and treat patients across India. We capitalized on that opportunity to do some market research and to understand how to go to market. And so we have our first couple clients in India coming online now, some excellent private hospitals. And that's more or less what we'll have our hands full, at least until the end of the year. Opportunistically, we have done some deals in other countries like Brazil, and may continue to do so, but primarily it's Canada, US, Singapore, now India.
Okay, so does that mean you're the only deal maker?
I am not the only deal maker that has worked for the company. We've had previously we've had other deal makers, but it's a much harder sell for them compared to myself as the founder, because I know things so much more deeply, and I can speak to them more passionately. And I think the client always feels more comfortable knowing that the CEO is behind the relationship. So our strategy this year is different, actually. Instead of hiring additional deal makers, we're hiring support for me as a deal maker.
Right.
So hire somebody who's really experienced and adept at creating the collateral, identifying who are the right potential new partners for us, and then giving that stuff to me, helping with the approach, and I go in and do my little song and dance. And then hiring somebody else who's a sales operation manager. We haven't brought on board yet, but we'll do soon. And they're really managing the CRM, handling small changes to the contracts that we go along to really try to help shorten the sales cycle and liberate a lot of my time so I can focus on the opening and closing.
Of course.
Then, there's always a certain amount of inbound flow. And the better we can automate that inbound flow, I think the better. And one of the big goals for me by the end of this year is to be able to monetize smaller institutions or even individual mental health care professionals. Right now, we're really stuck with the bigger contracts, which is fine. I mean, that's where the budget is. That's where we have our deals. I mean, it's great. They're awesome partners. But if you really want to, as we do, reach the entire globe, you need to have an offering that is attractive and works for all kinds of different practices. The giant mental health hospitals, as well as an individual, somebody who might even label themselves as a coach, who could be an MD even, but they prefer the title coach because in their mind, that's how they want their clients to see them.
Okay, so between the use case that you're working on in India and Singapore, like culturally, you already mentioned like the payment systems, of course, are different. Are there also cultural markers you need to take into account, or just maybe feelings hiding under certain different circumstances, different ways of growing up, different cultural values perhaps, or is that something that you can objectively just pierce through with your app?
In terms of quantifying how people feel, we pierce through all that. It's, we're looking at things like heart rate variability, distribution of blood in the face. We're not, these micro expressions. These aren't things that we believe have been impacted by any divergence in culture that's resulted, that's emerged over the last 100,000 years or something. So, we should be able to get objective measurements that are just as accurate for, prehistoric individuals as we do now. In terms of the therapy that we deliver, the contrast couldn't be greater. In that case, we really need to go in and create things locally. And for a market like India, that's a huge, huge endeavor, because India, while it's one giant democratic nation, it is comprised of an incredible variety of ethnicities, right? So different languages, different cultural upbringings, there's, class systems. I mean, it's India is definitely not one block of individuals when it comes to creating psychotherapy. And so we go into the local areas, we work with local professionals, we vet them, we get them into the studio, and then we create content, therapeutic content specifically for certain populations.
I also always want to hear a little bit about the person behind the company, of course, Besh, if you're up for that. I think in our prep talk, you mentioned a lot about growing up in that small little town of 5,000 people where there was always a party in the house with your 5 siblings, right? Talk more about that. How has that influenced, Besh, who you are as a man?
Well, it certainly makes me appreciate nature. I mean, I was outside my entire childhood. It makes me resilient and even crave the cold. We had snow on the ground 7 months a year. To me, the world has unraveled in layers, like an onion. Because I was, in a small, very, very small town when I was young. This is pre-internet, pre social media and all that stuff. So I was, I was in my own world. I had my friends, I had my family, I had the woods. My BMX, that was my childhood. I had skiing, played in the snow, $1 Million Snowman, etc. A lot of freedom. I could just run around and do whatever I wanted. I guess having that level of freedom as a kid has made me sort of want to continue to have freedom as an adult. But when I went to university, I didn't even realize that a scientist was a job.
So how do you feel like that childhood full of freedom and leadership experiments has made you into a leader you are today for your team?
Look, being a leader involves 2 things. Involves, first, most obvious, the ability to make decisions. live with those decisions, accept those decisions, take responsibility for those decisions, but to actually make them. That's necessary. That's what people look for leaders to do, is to decide on how to move forward, when to step and where. The other thing which a leader really has to do, and it's much more related to the word itself, lead, is to inspire, right? Build a culture, all those things that are necessary to galvanize people toward the mission. You can make a decision, but if nobody's willing to actually follow you in that decision, then you're not being an effective leader. And I think, for a variety of different reasons, I've been quite good at articulating a mission. First, identifying a mission that means something. And then articulating that to other people and getting their buy-in and bringing them together and including them in that mission, including them in the decisions that we make as well. And so why that comes naturally to me, I don't know, but it always has, obviously. I think part of it is not so flattering. I think part of it is, because I want to have control even over other people, which is not necessarily a nice thing, but can be harnessed to do nice things. I tend to be very, very empathetic as well. I don't mean I'm necessarily sympathetic, but I find it quite easy to feel how people feel if I so choose to make the effort to do so. And that's also necessary for leading people, because you have to, understand where they're coming from before you can bring them somewhere else.
So any advice for founders that are behind you?
There's a few things that I did in the early days, which I'm really happy I did. One is I made a huge focus on culture, and a culture that I would love, and that's important. People say that all the time, culture is really important, but it is, it's absolutely important. Another thing that I did, and this would be relevant for anybody who doesn't come from a business background, is read a lot of business books. I read a lot of books on strategy from many different, don't just read like Peter Thiel's 0 to 1, right? Like read 20 different books. My co-founders, Mark Thoburn and Vitas Maradian, and we read one business book a month for 3 years. And we took notes and we shared our thoughts and we rated them. And at some point in time, I had this vision that, we'll publish this list, and maybe I will someday still. But it's out of date, I suppose, now. But anyway, like read the books from many perspectives. Great advice that I got from my father a long time ago is that there are no heroes. There are no people in the world that you can hold up and say, that's the person to be like. But there are aspects of all kinds of different people that you can pull from, and that's something you can aspire to. That's something. And I think the same way about these business books, is get a bunch of different ones, pull them together, help you frame your thinking. And one thing that particularly if you're doing it with your co-founders, it gives you a lexicon that you can leverage together. Yeah,
that's a common language, right?
Exactly.
And I think it's the same with advisors and investors. Like none of them, I think, should consider a full hero in terms of like they have all the answers, right? It's more like picking up elements that are useful to you from anyone that can offer them to you.
Yeah, and a side point of choosing your culture is choosing your team, and that includes your investors.
I love that, yeah.
We were very, and have been and continue to be extremely careful who we let onto the cap table, and have turned down money multiple times. Not because we're like the greatest company, everybody wants to invest in us. No. It's not because we're flush with cash or we couldn't use it. It's because I see the culture as being the most important thing to the long-term success and the total amount of growth that we can achieve.
Besh, I think those are great closing words. So thank you so much for coming on the Scaling Without Breaking podcast. This has been an honor. Where can people reach you or find out more about Mobio?
Mobio has a website, mobiointeractive.com. We have a LinkedIn page. I'd be happy if you would follow the company LinkedIn page. My LinkedIn is Bechara Saab. And that's about it.
And
pretty
we'll
much
put
all
it
we
all in
got.
the show
Oh, we have a
notes. And of
YouTube
course,
page, we have a SoundCloud, if you want to get access to some stuff, but mostly LinkedIn and our website is the
can
place.
people try out the app, or should they be in touch with you first, or how does that work?
Absolutely. Our app is subscription free, actually. So people can completely use it. Our healthcare partners are essentially paying us for the interaction and the data that we provide and all that stuff. So yeah, anybody can just jump on and use it freely, perpetually.
Is it available in an app store, or how do they find it?
It's called AMDTX, AMDTX, at least until May.
Okay, yeah.
After May, it'll be called Dawn, DAWN.
Okay.
But for now, it's AMDTX, and then soon it'll be Dawn space DTX. And it's in the app stores, in Google Play and App Store, so people can go ahead.
Well, okay, we'll put all those links in the show notes for everyone to enjoy and learn more about themselves, because it doesn't matter what you feel. What matters is the objective reality, right?
I didn't say it doesn't matter.
I'm just a populist journalist.
It doesn't matter as much.
But no, of course you didn't say that, and I was just joking. But thank you anyway for joining the podcast, Bech. This has been an honor. And for the audience, of course, we'll have another amazing founder again for you next week.